work with to look after our customers. And we are so honored that she agreed so kindly to be with us this afternoon to teach us more on colds and flus. So I would want her to kindly introduce herself further and tell us where we can find her. So Dr. Kosgei, karibu sana. Dr. Runmut.
Good afternoon, everyone. I'm honored to be in this meeting today, in this partnership with Old Mutual, and I'm honored to be presenting to all of you today. So I'm Dr. Caroline Kosgei. I've been a pediatrician for the last 16 years. I've been in a lot of very busy practice, and so children are my business. And I am really, really honored to come and talk about colds and flus because this is one of the things that affects children. So thank you.
Thank you so much. And without further ado, I believe we can start. And over to you now, Dr. Kosgei, to kick it off.
Okay, thank you so much. So most of us know about colds and flus, but many people don't know there's actually a difference between colds and flus. But generally, colds and flus are illnesses, that upper respiratory tract illnesses. That means it affects the nose, throat, ears, so it's colds and flus are caused by viruses generally, but there's a difference. So, someone will get symptoms of upper respiratory tract infection and say, oh, I have a flu, or I have a cold. So many people don't know the difference between cold and flus. But colds are the most common infections, and they are caused by very many viruses. And that is why, as children are growing, or the older people, they tend to get a lot of the colds because there are very different types of viruses that cause them. So as they get the different viruses, they also develop immunity to those different viruses. And that's why you don't find a child getting only one cold and you say they have gotten an immunity. They need to go through so many viruses for them to get immunity. So most of them are self-limiting, and mostly people buy over-the-counter medication just for symptomatic relief. Next slide. So transmission generally is, the biggest transmission is direct contact. Direct contact is someone coughs on their hands or coughs on themselves or on a surface, and then you come and touch, or you touch someone else who has coughed. You touch your mouth with a hand that has touched the virus, or your hand touches your eyes. Aerosols means someone coughs on you. This is very common for children also. The tiny respiratory droplets are suspended in air. So whoever is in the environment, whether it's children or adults, they actually inhale the viruses, and it goes and settles in the throat or the nose or the sinuses, or contaminated surface. So you can have, clothing, or even desks, or rails, or when you're climbing the stairs, you can have someone who coughed, touch their hands, touch there, and then you go touch, and then touch your face or your eyes, and you get the virus into your system. Next, please. So generally, why I put this one up, this is looks more like a medical thing, but mechanism of symptoms of common colds and flu is almost the same, but flu tends to be more severe. So when you look at top, you will see the viral infection, and that is either the skin or the mucosa in the nose. So the virus comes in, it enters the mucosa. So it can go two ways. On the left, you'll see the viral RNA or DNA causing some things called macrophages, neutrophils, and cytokines. And these are produced toxins that now cause CNS, joint, and muscle pain. So that is where now you get the systemic symptoms like fever, muscle aches and pains, headache, tiredness, mood change. And then we have, once the cellular damage has happened on the right side, there's an enzyme activation, then something called bradykinin and prostaglandins are produced that affect blood vessel, glands, and nerves. And then now you get local symptoms around the nose, the eyes, like sneezing. Rhinorrhea is the clear mucus that comes out. You get the congestion, you get the cough because it goes all the way down to the chest, and also you get the sore throat. So as we go along, you'll see which one has, the colds have more of the local symptoms and the flu has both, can have both or just one, either the local symptoms and the systemic symptoms too. Next slide. So cold versus flus, how do you differentiate them? Because they have, as you see, the symptoms, they are all present in both colds and flus. So fever is rare or low grade in colds, but it's common and high, mostly more than 38 degrees in flus. You can have a slight X in colds, but in flus, you can have really bad body aches, pains, which is common and might be severe. Chills is when now someone shakes, you know, you're feeling like it's cold and you're having a fever. It's uncommon in colds, but very common in flus. Fatigue is mild in colds and common and severe in flus, because the fatigue will be worse because the temperatures are high, your body, you know, the muscles are having a lot of pain, your joints are having a lot of pain. So sneezing also is common in colds because, as I told you, colds affect mostly just around the nose, throat, ears, and eyes. So sneezing is common. For flus, it might be there, it might not be there. Stuffy nose is common in colds, and sometimes in flus, you might not have a stuffy nose or sneezing in flus. Sore throat is common in colds. Very rarely you'll find it in flus. And a cough will be mild to moderate in colds, but flus, you can actually even get pneumonia or even pleural effusion. Pleural effusion means you can get fluid in your lungs. So flus can progress to be severe if they are not caught in time and actually treated. Next slide. So flu symptoms and characteristic. So it's likely to be flu. First, if you have a cough, sore throat, congestion, rhinorrhea, which looks like it's a cold, and then, but it should also have one of the other symptoms like headache, malaise. Malaise means you just feeling your whole body is sick, muscle pain, sweating, chills, and frustration. Frustration means you just want to sleep. You don't have the energy to sit up and do what you normally do. Progression and recovery for colds, for flus, it's sudden onset. You will have sweat, you'll have chills, severe aches, dry cough, high fever. And then after that, it goes to a period of generalized weakness and malaise. And frequency comparison is that colds are common in children, more common in children than adults. Children tend to get 5 to 6 colds per year, while adults tend to get about 2 to 4 colds per year. Next slide. So some of the symptoms, it's important to understand some of the symptoms so you understand why doctors treat the way we treat. So running nose and blocked nose, we said it's more common in colds. Flus rarely, sometimes have it, sometimes don't have. But it's important to understand why running nose occurs. So running nose, which we call rhinorrhea, occurs in most patients. We said mostly with the ones with colds. Initially, it's clear watery fluid and may be followed by thicker mucus. This can also, though, occur with flus, but not as common. The blocked nose occurs due to dilatation of blood vessels within the nose. So when they dilate, they swell. So when they swell, they narrow the nasal passages, which further, and then the blockage is actually further worsened by mucus production. So two things cause blocked nose: dilated vessels and mucus production. So you get a viral infection, it causes inflammation, the blood vessel dilates, plus mucus production, then you get the nasal congestion. So next. So sneezing, coughing, and aches. Sneezing and coughing. Sneezing just occurs because the nasal passages are irritated. The viruses, when they're entering, they cause irritation and they cause a lot of sneezing. A cough may be present either because the pharynx, that is the throat, is irritated, or as a result of irritation of the bronchus caused by postnasal drip. So what happens when there's increased mucus production in the nose, as we talked earlier, with the congestion, it actually drips in the back. So when the child or adult goes to lie down, the mucus starts dripping and irritating the throat. And that's what is called the postnasal drip. So the throat may be irritated directly by the bag, or you get a postnasal drip that actually causes a cough. And that's why sometimes you can treat the throat. If you don't treat the postnasal drip, the cough persists. And then aches and pains and headaches. So due to inflammation and congestion of the nasal passages and sinuses, if persistent or worsened, this leads to sinusitis. So what happens when you get congestion of the nose? It blocks where the sinuses drain. So sinuses are spaces in the skull. On the front, we have them on the sides of the face. They are just spaces aligned by mucus lining. They produce mucus which you don't think about. You always clear your throat, or you pull something at the back of your throat, you never think about it. But when the nose is blocked due to flu or a cold, then it blocks where the sinuses drain. So what happens is the mucus collects into the sinuses, as you've seen in the diagram there, that yellowish stuff on the side, left side of the face, and that now can cause bacteria to come in and then multiply in that mucus and then cause sinusitis, which now leads to the headaches and pain in the face. So people with flu often report muscular and joint aches, and this one I talked about it earlier. Is because of the cytokines and all those things that the immunity tries to produce to fight the virus. Those are the things now that go and they cause the joint pains and muscular pains. Let's go down. One more slide. So facial pain, frontal headache, up, back, one, back, one. Yes. So facial, frontal headache, and high temperature. I think we've talked about this. So high temperature, feeling hot versus actual fever. So sometimes with colds, the patient can report that they're feeling hot and they don't have a fever. But generally, a high temperature will not be present in colds. Fever may indicate that it's most likely flu. So next. Let's go down. Next slide, please. So earache is also common with colds and flus, particularly in children. Up, go back one, and so it's common colds, especially in children, but also adults can get, especially if you have the nasal congestion and the sinus infection. So when the nostrils are removing that clear mucus or the thick mucus, it can lead to ear blockage due to obstruction of the eustachian tube. There's a tube that connects the throat to the middle ear. So that tube can actually block. And when it blocks, you have stuff collecting in the middle ear, and then you get a bacterial infection in it. So when a secondary infection occurs, as we said, you get something called otitis media. And this is also common when you're having colds and flus, and especially when you're having congestion around the nose. Next. Next slide. So treatment generally, most people tend to go for over-the-counter medication because for colds and flus, generally treatment is symptomatic. So basically, we advise patients when they're going to buy, because most of them will go to buy over-the-counter, they have to also be careful that they are not taking other medications that will overlap with over-the-counter medications. So the cough syrups and all those other syrups sometimes don't have an added value in treating colds and flus. So, so appropriate treatment generally is based on the symptoms, available evidence, and taking into account the patient preferences. So no antibiotics. If you've confirmed it's a cold or a flu, antibiotics are not appropriate unless the patient has been fighting the viral infection for a while and the immunity has gone down, and you've gotten evidence that they have a bacterial infection, which has come as a super infection now in terms of sinusitis and all these other infections. So those ones will require lab proof that it's actually a bacterial infection, so you can be able to cover them with antibiotics. And if once you've treated the flus and colds for a week plus and you're not getting better, it is important. Now let's go to the next slide to refer to the doctor, because then it might mean it's not the cold or the flu. So the specific symptoms and conditions, if you need to refer, is earache not settling with painkillers, with patient has a persistent fever with a productive cough that's not going away despite the symptomatic treatment, when the patient gets delirious, because sometimes the viral infections can actually go to the brain and cause meningoencephalitis, with persistent chest pains, because the patient might have developed complications of colds and flus, which sometimes is pneumonia. We also refer the very young and the very old, because the immunity will really struggle sometimes to deal, especially with flu. The children and adults who have heart and lung disease, kidney disease, diabetes, asthma, Those with compromised immune systems, maybe they're using steroids, they're on, immune regulatory treatments. And we always say, it's important to be reviewed in 10 to 14 days, especially if you have flu, just so that you've not developed complications in case the client is not getting better. Next slide. So management of flu. Flu, we have a non-pharmacological therapy, which is the commonest. Generally, we use saline solution for both colds and flus, especially if there's congestion in the nose, there's a lot of mucus coming out. And saline solution is good. It's made of salt and water, normally at 0.9%. So it can soothe the irritated tissue and moisturize the nasal mucosa. And the good thing with saline can be given in all age groups and comes in drops and sprays. So the younger children below 2 years, we tend to use drops. For the older children and adults, we use the sprays. And also it can reduce the swelling, where it causes a bit of vasoconstriction, which reduces, which means the dilated vessels can be constricted a bit, so the swelling can reduce. So generally for influenza, if it's mild influenza, we do a lot of rest, drink lots of fluids and adequate nutrition. Next. So if you do the fluids, adequate nutrition, and you're resting and the flu is not going away, sometimes we use what we call decongestants, which are sympathomimetics. They actually constrict the dilated blood vessels of the nose, the way we had said initially. The cause of the blockage and production of a lot of mucus is because of the dilated blood vessels. And then, so adults tend to use things like pseudoephedrine. We don't use a lot of those in children, but children, we use the topical ones, which can be drops or sprays, like the xylometazoline. For children, we have the 0.05%, which we use for less than 12 years. And for the ones who are more than 12 years, we use the 0.1%. Which can also be used by adults. So these ones go and constrict the vessels, which stop production of mucus and also reduce the congestion in the nose. Next. So as I said earlier, nasal sprays and drops. Nasal sprays are preferred for over 6 years. Drops we prefer for children who are over less than 6 years or even 2 years. And the reason behind the sprays is that if you give it to a small child, the risk of damaging the nostril is quite high. So we tend to use it 6 years and below, but sometimes even 2 years and above can use a spray, but we prefer 6 years and above to use the sprays. So the oral antihistamines can also be used. We have the sedating ones and the non-sedating ones. The sedating ones are the old ones like chlorpheniramine, like Piriton. So if the children are going to school, we don't give as much, but we tend to use them at night when the colds and the flus are affecting sleep. Then some non-sedating ones can be used if they want to still play and move around. There are so many examples, I just put a few. But these ones can reduce some cold symptoms such as running nose and sneezing, but are less effective in reducing nasal congestion, and even in flu. They're less effective in flu. These are mostly for colds. So let's go down. So we have the combination products also, which has a nasal decongestant and antihistamine. And I know most of you, if you have children, you've gotten these combinations. And the combination, the sympathomimetics, as we said, they reduce the swelling and reduce mucus production. And the antihistamine will reduce also the mucus production and reduce sneezing and irritation. So the combinations also work very well. If a child or an adult has cold or flu symptoms that are causing a lot of congestion, a lot of mucus production. So also we normally use analgesics or antipyretics, which is like paracetamol, Brufen for fever and pain. For flu, influenza, ibuprofen, or any other NSAID would be good. The ones that have anti-inflammatory properties, because of the muscular pains or joint pains. Paracetamol might not be very good for flu because it does not have a very good anti-inflammatory effect. Brufen and the other NSAIDs are normally good. So we also use inhalants, like either directly or use steam. It also helps to clear nasal passages. It will help the mucus to loosen, and then the adult or the child is able to blow it away and clear the sinuses and the nostrils. They are mostly used on colds though, like menthol, eucalyptus. They normally help. So next slide. So vitamin C and the common cold. So vitamin C is actually controversial. There's some studies that have been done, and they have said that not shown to prevent colds even at high doses. But there are some studies that have shown there might be a benefit in actually giving vitamin C in colds and flus because of its antioxidant capability. Where they say, you know, when we have these infections, these viral infections, the body produces what we call superoxide radicals and free radicals. These are the ones now that cause damage to the joints, to the muscles, and they damage also DNA and lipids. So what happens is the vitamin C actually counteracts that by being an antioxidant. So, and also enhances the immune system. So vitamin C, for some people it works, for some people it doesn't work. There's no real proof that it works directly when you have the flu or the colds and does that. But it's believed that it actually just helps to boost the immune system and to get rid of the free radicals and superoxide radicals that cause damage during flu and colds. So next slide. So prevention is key. So as we said earlier, prevention is key. We had already said how it's transmitted. So as much as possible, you stay away from people with colds or influenza, or as since the COVID times, we wear a mask. If you are around someone who's with cold or influenza, if they are not wearing one themselves, we avoid crowded places where risk of infection is greater. So do not touch nose or eyes after being in physical contact with somebody who has a cold or influenza. We wear masks when one has a cold or influenza so we don't spread it. So washing hands is actually the mainstay so that you don't touch your nose, don't touch your eyes with it. And then when you're in crowded spaces like in offices, hospitals, we always keep the rooms well aerated. So next slide, even schools and everywhere else. So for flu, let me talk about flu treatment because we talked about treatment I had not mentioned. So once we get a child or an adult who has symptoms of flu, and nowadays we can actually confirm because there's some tests that we can do, though they're a bit expensive, so they're not done a lot outpatient. They're done mainly for patients who are inpatient and they're really, really sick and maybe are getting complications of these flus. So once we confirm it's either influenza A or influenza B, we know there's actually an antiviral drug for flu specifically, and it's called, there are many products in the market, but we have antiviral treatment that is taken orally. There's formulation for both children and adults, and it's normally given for 5 days. And it really helps to prevent complications or reverse complications, or also stop the progress of flu. But flu as an illness is because it's not a cold, it's not caused by very many viruses. It has specific influenza viruses that causes flu. So flu has a vaccine that actually can prevent or reduce symptoms of flu. Colds do not have a vaccine because there are so many. We are talking about over 200 variants of viruses that can cause flu. But influenza has a vaccine. And the vaccine is indicated for active immunization against influenza caused by influenza virus in both adults and children, 6 months of age and older. It's also actually indicated for pregnant women. And the pregnant women at any stage, they can get the flu vaccine. And that is important because also it gives the child who is going to be born passive immunity for the first 6 months. And that is why the flu vaccine was made from 6 months onwards, because it's assumed when the mothers are pregnant, they also get it during pregnancy, which gives the child the immunity in the first 6 months. We've talked about, so annual vaccination using the current vaccine is necessary because immunity declines in the year following vaccination. So flu vaccine is a vaccine that is given every year, depending on what flu virus is actually in circulation. So the strain of flu changes seasonally, and the vaccine is therefore altered accordingly. And that's why we do vaccines for flu. It's the only vaccine that is given yearly. You can be given for life. So next. So side effects are uncommon, and we say the side effects are much less serious than developing flu or complications associated with flu. So flu vaccine is only contraindicated if you're currently wheezing or you have a chest infection, when you're on steroids or any other medication that is altering your immune system, or severe egg allergy, because some of the flu vaccines have some of the things they use to make the flu vaccine have egg in it, so it can cause an anaphylaxis, which is severe allergic reaction. So next. So thank you. Thank you. That's my presentation. I think I will leave the rest to questions and answers because it's so wide. There's so much we can say. So maybe it's just to talk about many things, myths. We bust some myths. We talk about, we answer the questions and see what people have been thinking about flu and colds. Thank you very much.
Thank you very much, Doc. Maybe Dr. Mary, you can assist with the Q&A from the chat
Yeah,
box.
thank you so much. Yes, thank you, Dr. Kosgei. I think I've also learned quite a bit from you from this presentation. It's quite, comforting to see that it's normal for young children to get, the colds up to 2 to 6 times a year. Because sometimes you wonder what's going on. Your child, you finish one, before you know it, another one. So clearly, it's not uncommon for this to happen. And it's really good to see that. As you said, our children are then gaining immunity as they encounter some of these viruses, as they go through these colds. Now, I'd really want to encourage all of us, feel free to ask a question. You can raise your hand and we'll be able to unmute you for you to speak, or you can actually write on chat and Doc will be able to answer the same. I can see there's somebody who has asked a question on what Old Mutual covers. I'd like us to quickly just share this with you so that we are able to see. Just bear with me a second. I want to be able to just project something. So we do actually cover. I hope you can see my slide and you can confirm for me, or Doc.
Yes, I can see.
Yes.
Amazing. So we do actually, through Old Mutual, for those who are our customers, we've been able to negotiate for quite preferred rates for the vaccine for both influenza and also pneumococcal. And those are the partners with whom we have been able to get preferred rates. Of course, with all our medical service providers, they are able to offer the vaccine. So please feel free to inquire. And if you want to be able to get really subsidized rates, and we are definitely speaking to more and more partners, you'll be able to see us adding them here. So we do cover for this through your medical cover. We also do cover for the human papilloma virus. I know Doc didn't cover this today. We'll cover this in a different forum. And being Cervical Cancer Awareness Month as well, we do cover for the cervical cancer vaccine, HPV vaccine, Gardasil, through our partners, especially Avenue and Gertrude's. And this, of course, is given for girls 10 to 14. We are looking to expand that from 9 to 14. So we are really big on vaccination and ensuring that we are all protected, whether from the influenza virus, as Doc has mentioned, but also pneumococcal and HPV. So without further ado, we can just try and answer some of the questions that have come on chat. Maybe, Anne, we can kick off with the questions.
Thank you very much, Dr. Mary, and also thank you very much, Dr. Caro, for a very insightful session. So the first question Dr. Mary has responded to. So we have a question: do saline solutions expire? Have quite a number at home and not sure they have a shelf life.
So for saline solutions, I would advise actually we just first and foremost just look at the packaging, because different companies make different preparations for saline. We have the hypertonic saline, they have the isotonic. So hypertonic saline means the usual saline we use in small children is 0.9%. But sometimes we have the hypertonic saline that are about 2.3%, 3%. So look at the spray or the saline solution and check the expiry date in the solution, because if you leave it again to stay for too long, and mostly 2 weeks, 3 weeks, it starts to, because it has salt, it will start to form salt particles in the saline. Because as the water evaporates or gets over, you start finding some salt particles in the saline solution. So most of the saline solutions, they will tell you use it for 2 weeks, use it for 3 weeks. So it's dependent on the product and the company that made the product. So they normally give you a cap there when to stop using. They'll tell you after 2 weeks, discard after, but even the ones for discarding after 2 weeks, you'll find the saline solutions are very small. So within that 2 weeks that you're using saline solution, and let's say your child has a really bad cold and they're removing a lot of mucus, saline solution like nasal, you know, the ones that are 0.9%, you can use it a lot of, you can even use it 2 hourly. So you don't have to have many remaining. You can use 2 hourly and just make sure you're douching and clearing the airway. They are safe to use because it's just salt and water. So I hope that has answered.
Yes, I believe very clear. Thank you. So how do you deal with a runny nose in babies, considering that they can't blow their noses?
So running nose in babies is, so let's start with the neonates. Let's say the small babies, the really small ones. So the really small ones, you buy the saline solution. And saline solution, by the way, you can buy it as a package nasosal, or you can ask your daughter to sell you the 200 bob one, the 300 bob one, which is 500 ml. It comes with something you can put on top, and you can withdraw with a syringe. And even you do something called nasal douching if your child normally gets really bad homers with a lot of mucus. But if it's not so bad, so the small babies can have a cold, have dry mucus in the nose, you can't reach it. You're trying to use a Q-tip, you can't reach it. So you use saline solution. You just put the nasosal, a few drops, 2-3 drops, massage, just allow the mucus the salt to work on the mucus and loosen it, and that mucus will come out. So for the older children, you can even use a big syringe. You can go to the pharmacy and get a big syringe, get the saline solution, which is 200 ml. They'll give you with something to put on top and withdraw. And the child can sit on front like this. You can push on one side and the mucus will pour from the other side. So even from home, we can actually do nasal douching. It's only that people don't know that it is doable. You can buy it's called normal saline. It's about 500 ml. The one we put up normally as fluid. You can actually use the normal saline to do douching for your children. Just buy a big syringe. You can even warm the saline a bit. Make your child face the front. Push on one side, and the mucus will fall from the other side, and it's very safe. So for the bigger children, you can do the douching. The small children use the saline massage, and most of it will come out. If you pull out with a tissue or something, it comes out. Or Q-tips now can be able to remove. But sometimes if you try and reach with those Q-tips, you can even, or those things that aspirate, especially for small children, can even hurt the nostrils on the inside. I hope I've answered.
Yes. We've learned something new. We've seen people do it, but we never thought that it can actually be done. So,
yes.
So just a follow up on what you said. When you're pushing the normal saline from one nose to come from the other side,
Yes.
does it hurt the child, or just the child has to?
The child. By the way, it doesn't hurt the child. And sometimes even that 500 ml of saline is cheaper than the nasosal, the small one. But it's easier to do douching with the saline. So you just ask the pharmacy to give you a big syringe. You just draw 10 ml or whatever, and then ask the child to just sit down, face the front. You press the syringe on one side, you press it, mucus will come from the other side a lot. And then you put on the other side also, it will come out on the other side. And that really helps for the ones who can't be able to blow very well, because it cleans from this side, pushes the other side, cleans from this side, pushes the other side. So that is called normally nasal douching. Sometimes in the market, there's products to do it actually. There's something called nail-made sinus rinse. It comes with the things you can be able to rinse the sinus or rinse the nostrils, but also you can do it easily because those ones are a bit expensive. You can do easily with just saline and a syringe. Or use the products that have been sold. For the smaller babies, just use the products that have been sold, put enough, and massage. They'll either swallow it and poop it, or they will sneeze it out, and then you'll be able to clean it out. But saline is safe to use in large quantities as long as it's not hypertonic saline. Hypertonic saline is it's a bit stronger, but the usual 0.9% saline, which comes in nasosal and most of the sprays, you can use as much because it breaks mucus. The salt breaks the mucus, allows it to loosen. Then it can be swallowed by the child, or it can come out on the front.
Okay, thank you very much, Doc. So the next question, just a second. What causes the wounds on the nose and mouth during flu or cold illnesses?
So when we're having a flu or a cold, the body is fighting the flu and the colds and the immunity of the child. So everything in the body is going to fight this. So we use up a lot of white cells to fight the flu and the cold. So sometimes the immunity of the child goes down because we are fighting an infection. So that is why sometimes we get what we call gingivostomatitis, oral sores. Most of them are actually still viral. The body was keeping them in check because the immunity was good. But once the body is fighting something so hard, it forgets about these other things. So these other things come up. And that's why sometimes in infection, even babies get things like oral thrush. They get things like, the oral sores, swollen gums, red gums, because those ones are caused by herpes. And that is something that the body had kept in check because the immunity was good. But now that the immunity is down, as the child is fighting another infection, then you get this super infection. You get a secondary infection that the body was controlling before. So children who have either, it could be anything, throat infection, colds, flus, sometimes they tend to get what we call gingivostomatitis. They get oral sores. They're normally viral. They're normally caused by herpes type 1, which most people have. And the body had kept it in check. But now, because of the infection, it causes, the immunity goes down, then the viral gingivostomatitis. Now they get the swollen gums, the oral sores. So that one, we normally just treat it as a secondary infection to the primary one, but we cover it with an antiviral, then we do the oral toileting. It's extremely uncomfortable for all children, even adults. It's extremely uncomfortable for everyone, but it doesn't say much. Once you help boost the child with, good nutrition and then maybe vitamins and what, it also helps to fight it. Okay, next question.
Thank you. So does concoctions, that's the mixture of ginger, lemon, honey, help with flu and colds?
Yes, it does. Remember we talked about vitamin C. I think that's why I mentioned about vitamin C a bit. As we said before, these concoctions that have ginger, we put a bit of lemon, we put a bit of, turmeric. They actually help. They do symptomatic, partly help with the immune boosting in terms of fighting those we talked about, free radicals and the superoxide radicals that are produced when your body is trying to fight. Those free radicals and superoxides are produced because when your body is coming out to fight an infection, it doesn't want to know, it will remove an AK-47 to fight that virus. So sometimes it goes way beyond and produces, so much of those radicals that now those radicals cause other symptoms like pain, body aches, and all those things. So vitamin C that comes and other things that come from these natural products actually help the body to fight those radicals and also helps the body to, as we said earlier, human beings, we don't produce our own vitamin C. We don't synthesize our own vitamin C. And that is why vitamin C is important. You have to take it orally. And as I've said now, it helps to fight those things that cause damage and make the colds and flus feel worse in terms of symptoms, So when you take the vitamin C, it also boosts your immunity. So, and that is where the natural things comes first. So with colds and flus, we normally say initially we start with those natural things. You start with concoctions, but when you've given concoctions for a few days, 3-4 days, then you see a new fever coming, or you see the symptoms worsening, or new symptoms coming, then you know here now I have to go above and beyond those natural remedies. But the natural remedies, I would say, give for at least 72 hours, see how it's working. If it's worsening, escalate and get other treatments. If it is working, then you just continue with it. And it will boost the immunity for the child to fight the colds and the flus for the adults. Any other questions?
Yes, thank you. So how effective is cod and propolis as an immune booster, especially when a child is starting school?
Propolis.
Yes,
I have not vouched for propolis that much, but I know propolis comes from the smaller bees, and maybe there's someone in the audience who knows what propolis does. But I know why honey is used is because honey has an antibacterial effect. Generally, propolis is also a type of honey from the smaller bees. So honey has an antibacterial effect, and they say actually natural honey does not get spoiled. It actually can stay for many, many years because it cannot be infected. If you leave honey in a nice place and close it, it doesn't actually get spoiled. So honey itself has an antibacterial and I think has an antiviral effect. And therefore, when you give children propolis, it lines the airways, it lines the throat, because children also, their throats have a lot of bacteria. And that is where also viruses land, especially in air droplet transmission. When they cough on each other, that's where the viruses and the bacteria land. So when you give them half a teaspoon or a teaspoon of the propolis, because of its antibacterial and antiviral properties of honey itself, it actually helps to prevent the viruses lodging onto the airway and entering the lining of the airway and causing disease.
And scald emulsions?
Scald emulsions, Scald emulsions, it's the omega-6 and omega-3 in the fish oil that is added, that is actually considered to boost immunity in terms of fighting viral and bacterial infections. So Scald emulsions actually, why it's given in children, and so it will not prevent fully, but it will help boost immunity. And especially in the smaller children, as we say, the smaller children, the immunity is still growing. They don't have immunity that is formed like adults. So children, the immunity forms and becomes like adults at around 5-6 years. Children who are below 6 years tend to have low immunity. And the younger you are, the lower the immunity is. And that's why you see infections tend to be severer on the smaller children. But as they grow, they start getting less and less of the infections, the viral and bacterial infections. And therefore, the omega-3 and 6, I think, work in the same way. They just help boost immunity to support the immunity to fight the infections. So omega-3 and 6 can be given, and anytime from 6 months, it's given, but at a lower dose, 2.5 ml once a day. And then as they grow now, after 1 year or 2, we add the dosage. But it can be given from 6 months after they wean because of the fish. The fish oil can cause allergies in some children.
Right. Thank you. So are cough syrups good, especially for children under the age of 5 years?
So cough syrups were banned actually. And if you go into the net and just type about cough syrups, you see the Gambia, other countries, children were dying in large numbers because of the cough syrup. So in our Kenyan community, I think they banned cough syrups for over 10 years now. So if you go to the major hospitals, you'll not find cough syrups. And the reasoning behind the banning of cough syrups is that children below 5 years always have a reason why they're coughing, and especially if it's a persistent cough. So we had said earlier, you give your concoction 2-3 days. After 72 hours, they know there's something else happening. It's no longer coughs. And why cough syrups were banned is because it had become an over-the-counter purchase. And so clients were not taking their babies to be seen, or the adults were not going to get seen. So you'd find a child has pneumonia and the parents have gone to the pharmacy. They have explained to the pharmacist, my child has been coughing like this. The pharmacist issues are maybe, let's say, a plant-based or natural-based cough syrup, but the child has a bacterial infection, is brewing a pneumonia in the chest. So since children also are not able to communicate, it became really, really risky because many children were dying of preventable causes, and the parents were continuing to give the cough syrups. So for children under 5 years, first and foremost, they're not able to communicate how they're feeling, what they're feeling. So it's important to have the child checked. And then secondly, there's always a cause, whether it is viral, whether it's bacterial, because you can even have a viral pneumonitis with a child. You can have a viral pleural effusion with a child. Pleural effusion means fluid in the lungs. You can have a child can have a viral infection and wheeze. So if you give us cough syrup that does not have anything to help with the wheezing, then you see the child will not get well. They might actually stop breathing. So, and then of course, as they say, the child might be having a severe infection, and the parent or the adults, even if it's an adult, is just taking something natural and not sorting out the infection. So that is why cough syrups were banned, because they were making doctors and healthcare providers and even parents not really think further than what could be causing the cough. So for children, they were actually banned. So cough Cough, if you give cough syrup, sometimes it actually worsens some of the coughs. So cough syrups are preferably given to older children. Ideally, they should be given to 12 years and above, because those are children, those are people who can talk for themselves. They can say, oh, I think my chest is tight. I think I'm not feeling very well. I think my chest is getting worse. I need to go back to the hospital. But the younger the child, can be very risky. Next
Thank
question.
you, Doc.
Mhm.
So just like something again on vaccine, for the flu vaccine, is it safe to be injected and how many times a year? So what are the side effects? I think these ones we spoke about, but maybe you can mention them.
Yes, so the flu vaccine is given for anytime from 6 months of age. As we had said, it's encouraged pregnant women to get flu vaccines because it gives passive immunity to the baby 0 to 6 months. Then that is why we immunize babies from 6 months, because that passive immunity would have disappeared. So we give them 2 doses. Children who are below 9 months, for specific products, 9 years, sorry. Children who are below 9 years, whatever stage they begin the flu vaccine, they have to get 2 doses, 21 months apart. Children above 9 years children and adults above 9 years don't need 2 doses. If you're starting your flu vaccine journey now, and you're an adult or a child who is 9 years and above, 1 dose is enough. And so it's given just yearly. Every year around the same time you go back for your flu jab. But children below 9 years, let's say 8 years, 7, if they're starting their journey even at 6, 7, 8 years of taking flu vaccine, they have to take 2 doses 1 month apart. And then after that, it just continues yearly around the same time they got. So if they got, let's say in December, then you take your child the next time in December. But with flu vaccine, you always have to check the expiry date, because I told you it's produced every year. So that is why you have to get a new flu vaccine every year. So the side effects, normally, the commonest side effects are just normally local, a bit of redness, swelling. You can get a bit of headache. The flu vaccine is not a live vaccine, it's an inactivated vaccine. So, but as I told you before, flu vaccine is better given, like if you have a child, you have the child checked first, ensure there's no flu, there's no wheezing, the chest is fine, and then we give the child the flu vaccine. But some people go to the hospital, the child is not checked, they just go straight, maybe the child is brewing a cold. So the cold comes up, the body is fighting the cold, and the flu vaccine is in situ. So those are the ones now who tend to look like they're getting really bad reactions to the flu vaccine.
Thank you, Doc. Another question. What causes a persistent cold, stretching for months, always having a type of runny nose?
So you have to remember, colds are actually viral in nature. We have said there are over 200 types. But there are other also causes of rhinorrhea, which means your nose runs. Your child also could be having allergies. It could also be an adult. You could be having also underlying allergies to something else you're using. You could be having something like cow milk protein allergy. You could be having allergy to wheat. You could be having allergy to pollen. So your airway is actually discharging because of another reason. Colds ideally are supposed to run their own course and go, even without treatment. The other things are just supportive. The saline, the things we drink, all those things are supportive. They're just supporting, and they're trying to help, feel a bit comfortable. But viruses generally run their own course. They're supposed to be about a week or 2 weeks at most. It should have gone. And over time, you see it getting better and better, and it goes. But if you see a cold that is recurring or persisting past that period, your child might actually be having other issues that are causing it. And mostly it's allergy. It could be cow milk protein allergy, the type of milk you're using, the quantity of milk your child is taking. It could be porridges. Maybe when you buy mixed porridges, your child is reacting to it. The airways are discharging. It could be things even like mosquito repellent that you put in your rooms, and they're going out the whole night. The children are inhaling, so they're coughing and they're having blocked nostrils, throats that are irritated all the time. So, things that are preserved like juices, all those things. So if you have a child that has colds and flus that are back to back, sometimes there might not be an infection per se. It could actually be another reason. And the other common reason is allergy.
Yes, I've got the next question. We're having quite a few. Also, if you skip a year of vaccination for whatever reason, are you susceptible to severe attack or depends on the strain of flu in circulation? And is influenza a more severe than B or vice versa?
Is more severe than
Influenza A. Is influenza A more severe than B
influenza
or
B,
yes,
vice
vice
versa.
versa?
Actually, both influenza A and B cause severe forms of influenza. But influenza A, you know, is H1N1, H3N2. So H1N1 and H3N2 are the ones that caused the flu pandemic in China in 2008, and it actually killed quite a bit of people. So we never used to have the influenza viruses besides. But once China opened up Guangzhou and the rest, and you know the world became a global village, so we started getting the H1N1 and H3N2. And also the capabilities of testing this, the biofires, respiratory biofires, and all this. That is when now we realized they were here. So H1N1 and H3N2 are influenza A. Then there's one that has a Japanese name. So influenza B are different. They are a little different. So influenza A and A is actually more severe than B, but both of them can cause severe disease. And that is why they were all included in the vaccine, which is the Vaccibrio tetra. An example is the Vaccibrio tetra. And so when we do this test in the ward with children who have severe infection, so you say, I've treated everything, it's not getting better, let me check if it's flu. Most of them you get it's either influenza A or influenza B. The other influenza, like viruses called parainfluenzas, those ones actually just give you cold-like illnesses. They don't give you the severe illnesses. But influenza A and B for sure, they give severe illness. Next.
Yes, Doc. How effective are the flu vaccines and why give them annually? Is COVID-19 back or is just a new flu strains? And are inhalers safe for kids? And what's the recommended duration of use?
So let me start from the end. Inhalers are safe for kids. And you will realize now that the cough medications were removed, the cough syrups. The recommendation now went back to using inhalers. And I will tell you some of the indications for inhalers. So indications for inhalers are asthmatic children. So this child has been diagnosed with asthma. So that's a child who has to be on inhalers. And you will realize the children who are asthmatic, most of them don't have maybe parents who have family history. It could be just asthma that they've developed and they will outgrow it. Normally, by the time they are between 12 to 17, most of them start outgrowing. The ones who don't outgrow tend to have close family members like mother or father who are asthmatic. So you find those children might grow into also adulthood with asthma. Now, many colds and flus and bacterial infection in children cause wheezing in children. So you might find a child who comes with cough, they're not asthmatic, they're not on inhalers, but they have a viral infection like respiratory, RSV, and then you listen to the chest and they are wheezing. So because the end mechanism is the same, that it goes to wheezing, you'll find this child will, for that point in time, will be prescribed for an inhaler. But this is not an asthmatic child, so they might not require that inhaler for a long period of time. They'll just require an inhaler in this period that they're coughing and they're having this bag that has caused them to have wheezing in their chest. So I always tell parents, children don't get addicted to inhalers. You don't have to get scared of inhalers. And inhalers and children, as I've talked before, when we talked about these coughs that don't go away, you will find some children have a form of an allergic cough, like an allergic bronchitis. So they're not asthmatics, or they run around and that child will stop and cough and cough. So they don't go into asthmatic attacks, but they have variants of what we call things like nocturnal asthma, exercise-induced bronchospasm. They get a wheezy chest when they are running around. They have underlying allergies due to other things, but they don't have severe wheezing, to be called asthmatics. So these children, they benefit actually from inhalers, especially the ones who cough at night, cough towards early morning. When they're running around, they're coughing. Those ones benefit. If you give them other medication, it doesn't work. But we normally give them the inhalers. Then we find out what is causing this kind of cough. Maybe they're having cow milk protein allergy, or they're having allergy to something else they're taking in the house. So when you remove the allergen, then you find even this child does not require to use these inhalers for a very long time. So when you see your child also requires inhalers for a very long time, it's important also to go back and look at what am I giving them that might be causing them to have this allergic state that makes them require to have inhalers. So in terms of taking care of allergy in children, which asthma and wheezy coughs are part of, allergen removal is very key. You have to always explore that option of removing allergens before you now just say, I'm going to use inhalers for a very long time. So you have to discuss with your doctor and say, Doc, could there be another cause why we need to use the inhalers? Could we go through maybe there something that I'm giving that might be making my child require to use these inhalers because we don't have a history of, or asthma in our family, or we don't have a history of one or two. But sometimes the infections themselves can actually cause. So infections can cause that, and of course, allergies. So the other question was on inhalers, or not inhalers, on vaccine.
Yes.
Remind
so the
me
other
what
question,
was.
if the vaccine, sorry, how effective the vaccines, the flu vaccines are, and where we get them annually, and if COVID-19 is back.
So, so if the flu vaccines, the efficacy is about 60 to 70%. It doesn't go all the way to 100%. So, and that is why you can get the flu vaccine and still get flu, because it's not 100% that you're going to get the flu vaccine and you're not going to get flu. But when you get the flu, the symptoms are going to be much less, and the risk of going to complications is going to be much less. Because we've had parents, even I have seen parents of my clients, the child gets a flu, gives the father, and the father goes to ICU with fluid in the lungs. They even think he has TB, it's influenza that has caused it. So, but the child was immunized, the dad was not immunized. So it just reduces the risk of going into complications and also reduces the severity of the symptoms, but does not say you will not get the flu, because it's not 100%. Immunity is not 100%. It's around the 60s. Yeah. And then the last question was there, you said something about
COVID-19.
COVID-19. So COVID-19, because I still work in the wards, mostly Nairobi Hospital and Coptic, but I've not seen COVID-19 in the let's say in the last 1 year. But even the ones we have found are just far in between, but they ride with the flu. So COVID-19, the ones we have seen, they ride with the flu. So the flu season is normally around February to April, and then it comes again September, July. The cold season, as it goes towards September, is when we get the next round. So even this hot season, we have the flu season right now. They will start coming with influenza right now. So what happens is COVID-19 has started riding on influenza. So the seasons we are seeing influenza coming, influenza A and B, is when now we are picking up a bit of COVID. But also the COVID that we are picking, they're not SARS-CoV-19, most of them. They're those small COVID, the other COVID viruses that are not COVID-19. Those ones cause flu-like illnesses, like not flu, they actually cause cold-like illnesses. But the SARS-CoV-19 has gone down, honestly, and it just rides with the season that the flu comes. So sometimes someone is treated for flu and they get better, and they have COVID-19 together with the flu.
Okay. The next question. So there's a very good question here about the vaccines. So please speak on the trend we are seeing of Zithromax and overuse of OTC, over-the-counter prescriptions.
Or the overuse of over-the-counter prescriptions for flus and colds.
Yes, and the Zithromax.
And Zithromax. I think the thing about Zithromax came with the COVID. You remember COVID was a virus, and it was being used to treat COVID. So most people believe that if I use Zithromax in a viral infection, it's going to work. But by the way, as we said earlier in my presentation, antibiotics are not needed if you've confirmed this is a cold or a flu. But it does not say with a cold or a flu, you cannot get a bacterial superinfection. So the need for an antibiotic comes the way we had said. If you have maybe earache, it persists. If you have a headache that is persisting, because you might have started with a viral infection and then you get a bacterial superinfection on top of the viral infection. So if viral infections tend to run a course and go by themselves. So if you are taking all these things to support you and you're feeling like I'm not getting better, the symptoms are getting worse, the fever is persistent, headache is persistent, I'm getting delirious, I'm getting ear pains, the fever is not going down, then the likelihood that you've gotten a bacterial superinfection on top of the viral infection is very high. Then that is the time now you require an antibiotic. But most people, I think they treat themselves too, in the sense that they don't need it, but since the viral infection is going to get better anyway, they believe that the Zithromax I took helped. But sometimes it might not really help. The viral infection will just get better by itself.
So closing in the next by the next 4 minutes, but the doctor is how can we be empowered as parents to speak to our doctors or liaise with our doctors to avoid this prescribing of antibiotics for both adults and children? Because it's gotten to a point where when a parent goes to the hospital and they don't live with an array of medications, or maybe they just give them maybe the ibuprofen, they feel like their child has not been treated well, and they may end up now even asking for these antibiotics. So how can we be empowered to liaise with our doctors to avoid all this?
Yeah. So I will give you two scenarios. So the client has mentioned one scenario where you go to the hospital and you over prescribed medication. But on the other hand, also there are people who go to some hospitals and you're given minimal treatment. And you see the situations can go both ways. So you can go, let's say, to a hospital, your child is thin and you're told to go home with Panadol only. Just monitor the fever and go home with Panadol. And then you find your child getting worse. Within another day or two, you go to another hospital, they find the child has a very high infection. And then the parent, I went to this hospital, then later I went to this one. Then you see they did not catch this in the first hospital. So it goes both ways, because sometimes you go, the other doctor now covers everything to make sure you are covered. And then you realize you did not even need all that medication at the beginning. So what I normally say, if your child has symptoms of a cold, and a cold is very typical, you'll see it. Running nose, it might have a slight fever or even a high fever sometimes. But teary eyes, running nose, you can see obviously the nose is running, and then maybe a slight cough. You can tell this is obviously a cold. That one you can even observe for 2 days. You give the concoction, you give the fever medication for the next 2 days. As long as your child is up and about running, try and douch the nose with saline, try and clear it and see, steam them sometimes and see if it comes out. If you do all those things, and within 2-3 days you start the fever breaks, the child is up and about, is playful, then you're okay. You don't even need to go to hospital. But if you give the fever medication for 2 to 3 days, and then you see now the fever is persisting, the child is becoming dull, is not playing as well, is not feeding as well, then that's the time you say, oh, let me go back to hospital. Let me now go to hospital, because now it's getting worse. So when we go to hospital, and that's sometimes the importance of testing, because then you can make a decision if you do test. Because if you treat sometimes children based on how they are, you might leave the sickest child to go home, and the one who is not even sick, you will give them all the treatment, because you know how children, how we all handle illness and stress is very different. One person can be very sick and they don't look sick, and the other person might not be that sick, but they look so sick. They look like they are going in the next minute. But when you do blood, you see this person is actually very sick, and this other person looks like they're not even sick as much as they're looking very sick. So sometimes blood work helps us to make that difference. Is it viral? Is it bacterial? And that's why we encourage parents, when the child gets flu-like symptoms, or not flu-like, like colds and this, you don't even need to rush to hospital the first 2 days. You can actually give fever medication 48 hours. Allow the child to run around, take fever medication, just clear the nostril with saline, take care of the fever. If they're eating, playing, keep them at home. And if the fever breaks and they're okay, keep them at home. They're able to fight, do the concussions and everything. But if now within those 48 hours, now your child is not improving, that fever is persisting, they're still dull, then you can say, now this is not the usual normal cold. I need to go and have it checked. So once you do all these other things, then you the child will be okay. So and she has posted for me the prevention, the way I talked. So in baby class, nursery schools, because kids tend to cough on each other, I would say if your child is unwell, you keep them at home, because now your child will also go and give the other children. You can talk to the teacher and say, let me keep them at home. So it's just about the school being able to coordinate and make sure the ones who are really sickly are kept at home and treated so that they are not able to pass. Because you can imagine the small children, they don't remember, they cough on each other's faces, wearing masks, they remove and they share, so there's a certain age, even controlling that will be very difficult. But I think teaching children to wash their hands regularly, they can carry sanitizer and sanitize their hands. That is important. But the older children, I think it's easier to control. Though sometimes by the time a parent realizes their child is sick, they've already spread the virus to the others and everyone else has got it. So it's just the basics we talked about, wearing masks, avoiding going to places where it's crowded. If it's schools, the child who is unwell to be kept at home and treated so they don't pass it to the other children. Yeah. I don't know if I've answered.
Thank you. Thank you very much, Doc. We have really gone into time, and I think this is because the session was really, really insightful. We've learned a lot of things. You have really taken us through, and myself have really understood a lot that I didn't. So we've posted our AFYA newsletter. We've also posted our partners for the flu vaccine, and there's a poll which is also running. Please just respond before we leave. And before we close, I would like to welcome Dr. Mary so that she can give a vote of thanks, and then Daktari, you'll be able to close the session. We have also projected Daktari's contacts. If you want to book an appointment or you want to go and visit her, we also have the same on chat, so you can save the contact for your future use. Once again, thank you very much. Up to you, Dr. Mary.
Thank you. Thank you so much, Anne, and thank you, Dr. Kosgei, and our guests for this afternoon's webinar. We really appreciate the information, the wealth of information that has been shared with us today. I personally feel more empowered, even as a parent, on how to manage my children when I start noticing some of these signs of colds. And also, I now know how to differentiate between the cold and the flu and what to do. I also want to really appreciate our audience for the interaction, the questions, and also for filling the poll. We really look forward to hosting you again and again. Feel free also to reach out to us. In case you missed anything, we'll be able to share with you. We'll share with you some of the information we have on vaccination and also Daktari's contacts in case you missed it. Thank you again, Daktari, for your time. We appreciate you as our partner and also for the service you're giving to us in Kenya. Thank you very much.
Thank you.
Bye, everyone.
Bye.
Thank you.